So thank you so much for being here. I want to welcome you to our webinar this afternoon. My name is Amy Blackshaw. I'm the Behavioral Health Project Director at the California School-Based Health Alliance, and I'm really happy to have you all join us today for our conversation focused on supporting youth with adverse child experiences, or ACEs, and learning together about healing strategies for responding to ACEs. We're really thrilled to have an expert panel here for you from UCAAN, the UCLA-UCSF ACEs Aware Family Resilience Network. This is the second in a series that we are hosting that's focused on ACEs in the school setting. And the first was held back in October. We will share the link to that webinar slides and recording later on if you would like to check it out. Again, thank you so much for being here. We will be recording today's webinar, or we are recording right now. So anyone who has registered will receive a follow-up email from us that includes the slides, the recording, and any other supporting materials or links that we share. So you will get that in the next couple of days. We have some time at the end reserved for questions, so feel free to put those in the Q&A. I think we'll be able to get to a lot of questions. And also at the very end, we'll have a few moments for you to complete a very short evaluation to really give us some feedback on how this webinar was for you. So first, I want to just introduce you to the California School-Based Health Alliance. If you're not familiar with us, we are a statewide nonprofit, and our mission is to improve the health and academic success of children and youth by advancing health services in schools. So we do this in several ways. We're based on the premise that healthcare should be accessible and where kids are, and that schools should have the services needed to ensure that the health of their students is not a barrier to learning. So we do capacity building, technical assistance, we do webinars, convenings, workshops. We identify experts in the field who are doing school health work and share best practices. So we have lots of resources on our website. So please, if you haven't taken a look, you can find lots of good resources. You can sign up for our newsletter there. And we also host an annual conference every year in the spring. This year, we're going to be in Anaheim at the Hyatt Regency Orange County. It's on April 28th and 29th. So please save the date. We'd love to have you attend. We'll have many workshops, including a workshop focused on becoming ACEs aware. So you can go in person and take the ACEs aware training and become certified at that session. If you would like to become a member of CSHA, we do have a membership that allows access to materials and also discounts for our conference. So if you're planning to send more than 2 people from your organization, it really pays off to become members so that you can get those discounts.
All right, welcome everyone. We are so excited to have you here with us today. Today's webinar is Supporting Youth with ACEs, Healing Strategies for Response and Connection. And today we're going to be talking about supporting youth with ACEs or adverse childhood experiences and equipping them with the tools to thrive. We're going to highlight some evidence-based approaches and practical techniques to help youth manage stress, build coping skills, and enhance their mental well-being. So whether you are a healthcare provider, a behavioral health clinician, a counselor, an advocate for youth well-being, or any other role, we're glad you're here. And we think that this webinar will provide tools and inspiration to help young people heal from adversity and build a foundation for lifelong resilience. We will, like Amy said, we'll have the Q&A and chat features on. They're open. If there's anything at the top of your mind, please feel free to put it in either one of those anytime during the session. We may be able to answer some questions throughout, but we will have some dedicated time at the end to answer questions as well. Next slide, please. Thank you. All right, so let's do some introductions from our side here. So the plan for today was to hear from two of our ACEs Aware young adult patient advisors, but sadly, Celeste is not able to be here with us this afternoon. Celeste, we are sending you lots of love, and we're so happy to have Jada here with us as well as Dr. Rachel Gilgoff. So I'll start off by introducing myself. I'm Chris Bradley. I'm a licensed psychologist and the head coach for UCAAN, which is the University of California ACEs Aware Family Resilience Network. I specialize in treating trauma and toxic stress and in the implementation and response of trauma informed care and ACE screening in primary care settings, which we are now translating into school based settings, which is super exciting. I was a coach for the California ACEs Learning and Quality Improvement Collaborative, otherwise known as CalQuick. It was California's first ACE screening collaborative, and I got to work with Dr. Alicia Lieberman and others to create a framework, an evidence-informed framework for ACE screening and response. It's called TRIADS, otherwise known as Trauma-Informed Inquiry for Adversity, Distress, and Strength. So many acronyms. And it's a relational framework that helps healthcare team members and any kind of team members that are talking with patients, clients, families, students in the context of a healing relationship. And I'm actually going to get to share some of that with you a little later in this session. I'm very excited. And for right now, I'm going to turn it over to Dr. Gilgoff to introduce herself.
Hi, everybody. Thank you so much for having me here today. Really excited about the conversation and partnering with all of you. I am by training a child abuse pediatrician, did that for 10 years, then got extra training in integrative medicine. I work at a small clinic. I'm an advisor with the ACEs Aware Initiative, and I do research at Stanford. And so really just excited to be here and collaborate with all of you. I can pass it to Jada.
Hi everyone, my name is Jada Imani. I am a patient advisor with ACEs Aware and also was a part of the process, the of building the Live Beyond campaign, which is the first youth-led statewide campaign in California around ACEs. You'll hear more about that later. I've spent the last 11 years in the nonprofit world, specifically focusing on youth development, community building through arts and culture for systemic change, and all things culture work. And thanks to ACEs Aware, the last year, working with ACEs Aware the last year and a half, I've been able to get more into public health, which is a newfound passion of mine. And I'm really happy to be here with you all. Thank you. Should I move to the next slide?
Yes, that'd be perfect. Thank you.
Wonderful.
Awesome. Okay. So here are our learning objectives for today. We're going to, by the end of this, you should hopefully be able to describe the role and importance of school-based health centers in supporting youth with ACEs, describe and apply trauma-informed communication strategies with youth in the school-based health centers, discuss and apply stress mitigation strategies with patients and students, and identify examples of community-based support services for stress mitigation strategies. And with that, I'm going to turn it back over to Jada for a mindful moment.
Thank you. I want to invite everyone to take a moment to turn inwards, maybe lower your gaze or soften your gaze, and just focus on your internal self and take a moment to sink into your own being and imagine yourself in a bubble. And it's about an arm's length away from you all around in terms of length. And make this bubble whatever color feels most nourishing to you. Maybe it's a cleansing blue, or it's an electrifying green, or it's a comforting purple. And then at the base of your spine, imagine a grounding cord reaching deep into the earth. And through that, you can release anything that you need and also absorb the earth energy beneath you. Also, you can grab a shaft of light from the cosmos, send it through the top of your head, like your crown. Okay, cool. Look at you connected to the earth. You're connected to the cosmos. You're in your bubble. It's nice here. Now you can welcome all of your energy back to you. So you might have left it in your phone or in your to-do list or on your other tabs or in the conversation or in your dreams last night. You can imagine as if you have a whistle, you call your energy back and it's just pouring back into in a bubble above your head. You gather up all the pieces of yourself that you might have left in different places. All right here in this present moment, whole, complete, reunited with yourself, present, aware. And this bubble above your head, you can also treat it with whatever intention. For example, maybe your intention is to learn a lot today. Maybe your intention is to come up with new creative ideas to engage youth around addressing ACEs. Maybe your intention is to simply be relaxed and enjoy the webinar. Now you can pour that bubble back, the bubble above your head back into your bubble because it belongs to you entirely. And now you have your own little vibe going on. And I want to invite us all to take 3 deep breaths as we close this practice. You can exhale all the old air out and inhale slowly. And we pause and exhale as slow as possible. Nice and easy. Let's do 2 more breaths, inhaling slowly. Give ourselves a pause and exhale nice and slow. Last one, inhaling slow, pausing briefly, and exhaling slow. Now I invite you to slowly bring your attention back to the webinar. We have plenty to cover and happy to have you here. I'll go on to the next slide. Thank you. All right, so there's a lot to cover in this webinar because it's an intersection of a lot of different things. It has to do with school-based health centers. It has to do with youth at different developmental periods. And it has to do with ACEs and addressing ACEs. And at ACEs Aware, we have so many different projects and like I said, even a campaign around it. So there's a lot to cover. These are a few bullet points that we came up with when brainstorming around what we would like to share for this webinar. In addition to that, I really wanted to incorporate what is top of mind for you all as the audience. There are a few questions that you all sent in when registering. The first one was, what are some examples on how the nurses and health staff could assist with the ACEs implementation on school campuses? Another is guidance for school mental health teams. Any tips or best practices on how to integrate this into a teen clinic? Very similar question. Another, I'd love to hear or learn more about how protective factors are also discussed with youth experiencing ACEs. Cool. So thank you all so much for that. Let me scroll down and see if anyone has any other. I'm an independent educator, writer, illustrator for children, teens, and families. I write about adverse childhood experiences and healing relationships. I would love to be a member and learn more. That I can apply my writings in relationships with readers, parents, teachers, and counselors. Wonderful. We love to see the community building connections being made. So quickly want to speak quickly to the questions that got sent. So in terms of integrating ACEs education into a school-based health center context, and I can speak from my experience receiving school-based health center services and also being a part of ACEs Aware, there's a few ideas. So we don't want to necessarily, press such a sensitive issue. It's a lot to process especially if folks are becoming aware of ACEs for the first time, and if folks find that they actually have experienced ACEs or is resonating for them, it can be very painful. And so in terms of introducing it, I think that, yeah, education is the best way, and some education is nonverbal. So one thing that I was thinking about is a poster for the school-based health center, like to put on the wall. And on one side, it's a list of the 10 ACEs. And on the other side, it's a list of the stress busters. That way, visually, when folks walk in, they're sitting and maybe waiting, they can start to see like it's spelled out in terms of what ACEs are and the adversity, but also in terms of the way that the adversity can be managed or mitigated through stress busters. So that was one idea that I had. Another is to have a screener available on site and make it optional. Maybe if there is capacity throughout the visits, or if there's capacity to designate one person as the ACEs person or a couple of people as the ACEs people, for every young person who enters the school-based health center at the beginning, middle, or end of their session with the healthcare provider, ask them or mention, hey, by the way, we have ACEs screeners here if you're interested in getting screened for ACEs. Or, yeah, do you know what they are? In addition to that, another way to educate is to incorporate, for example, the Live Beyond campaign collateral. Again, the Live Beyond campaign was the youth-led campaign, ACEs awareness campaign we developed. There are already existing posters there, so you could put those posters there. And the intention of those posters is also to represent the young people who are in there, so maybe they might see themselves reflected. There's also a website, and I'll share more about that later, where you can send folks to so they can see other young people sharing their stories and the ways that they've learned to heal. Yeah. And so now I'll get into some of these bullet points. Cool. And so I want to start with elementary school because it's such like a young age, but in my experience, that was when I started going to school-based health centers. And also sometimes I would go to the clinic just when I knew I needed a break from class. Like I had a really bad dream, or my like home was just really crazy, or I didn't sleep well, or I wasn't feeling well emotionally. Sometimes I could use a physical or legitimate excuse, even at that young age, like 6, 7 years old. Not even a younger than that, around 6 years old. No, but yeah, before the age of 10. Um, I could say, okay, my belly hurts, but really it's that I need a break because I'm not feeling well and I just want some respite. That's when I would go sometimes to the elementary school, school-based health center, just to have a safe place where I can, yeah, decompress or reground or um, kind of like, yeah, balance myself. Yeah. And I think that's really important, you know what I'm saying? And I shouldn't necessarily have to make a physical excuse. Maybe there's a world in which students can go to health centers shamelessly because they're not feeling well mentally or emotionally. But as I'm going to go on to the second bullet point here now, as you get older, middle school, maybe not so much, but high school, at least in my experience, I felt like if I wanted to go to school-based health center and high school, I'd have to sneak in so nobody would see and be like, oh, what she's going there for? Like, what she got going on, you know? And why is that? Well, probably because there's a bit of a stigma there, right? It felt personal, and it's like, all these things in our bodies, my body are, at that age are changing a lot. And the way we interact with our bodies is maybe different, and the level of education required to keep ourselves safe and healthy also is different. And that goes into the third bullet point about sexual or reproductive health. But to wrap up the second one, I will say that one idea I had for destigmatizing school-based health centers is to leverage the young folks who are at school to reach out to other young folks. So it's like peer referrals, peer encouragement. So we shift the culture around school-based health centers to be a place that is welcoming and cool and normal to go to, because Maybe you have a team of young people that go give presentations in classrooms about all the different things that the school-based health center at their school provides that folks might not know about, including ACE screenings. Um, or also access to reproductive health services. And so that's another. Or like there's also a sort of like mentorship or brother sisterhood that can be cultivated, because in a lot of ways school-based health centers can be a safer place for people to go, or the school-based health center workers will know more about the high schoolers that they're working with than their parents will, because it's not safe to talk to their parents about those things. Maybe in their home, going back to the third point here, abstinence is the only form of sexual education they've ever received. And they don't know how to navigate the different scenarios that they are confronted with. Or there's changes happening to their bodies that they don't know how to manage. And so it's the folks at the school-based health centers that can help them be safe, informed, and equipped, right? And so that's really, really helpful. Maybe there's a case of infidelity in their relationship that they didn't know about until they got tested. You know what I'm saying? So there's a lot there that's also really powerful. And then in terms of ACEs as well, a lot of these students, especially if they're experiencing a lot of adversity, maybe aren't getting the care their parents or support system. The system is either non-existent or doesn't have what it needs to make sure they're going to the doctors regularly. So the first line of defense for their health is the school-based health centers, where they can see that ACEs also relates to other things, maybe sleeping issues, maybe digestive issues, maybe weight issues, maybe social and relationship issues. And so when we start to educate young people about the fact that ACEs not only affects, maybe your physical health, but also could affect your mental health and affect whether or not you have friends or you feel comfortable and and a sense of belonging with your friends or able to build community, that makes it a lot more relevant. Young people really care about their connections and their social life, and might not make that connection between trauma and how they socialize. And so there are different I think it's so important to think about creative ways to help make those connections. And maybe it's like an activity or a game, or maybe it's a quiz, like the kind of cute little quiz we used to have in the early 2000s online, something like that, right? Think like really get creative with that. And also, I'm a big advocate, and so is ACEs, aware of involving young folks in the things that you're designing for them. So if you want to think about different lighthearted activities to help slowly introduce the idea of ACEs and healing and ACEs awareness, you can have a, a group of young people, almost like a council that meets once a week or once a month at the school-based health center, and they help develop these activities and try experiments for ACEs education. And this also could be something that they get extra credit for in school, right? So there's so many different possibilities for expanding, and young people are so brilliant and so creative. So much could be done there, especially if, the adults at the school have limited capacity or feeling very stressed. Young people can bring a fresh energy and really get things going. Or also pair up with an existing club that's already on campus. Yes. And what I was going to say is that for young people who are experiencing a lot of adversity and do not maybe have regular doctor visits or any other healthcare, school-based health centers are uniquely positioned for them to be accessible regularly because school is a requirement in the US. And that's really, really powerful. And that's also another point that Celeste made, is like not to underestimate the fact that it's on campus and so available, maybe more so than anything else that these young folks have. I mentioned a bit already for the second to last point about school-based health centers being a safe space to decompress. I mentioned that like in middle school, or excuse me, in elementary school, when I just was feeling stressed and just needed a break, go see my ladies at the school-based health center. But I shouldn't have to pretend again, right? Shouldn't have to pretend that I am nauseous when I'm really just feeling sad or just feeling overwhelmed or feeling at capacity. And so if there is a way to, and Celeste mentioned too how she even enjoyed lunch at school-based health centers because it's where she felt most safe, right? And if I'm not mistaken, there was also, if I remember her saying that there was a girls group there too. And so that's another creative way that you can welcome young folks as a safe space to decompress. And it doesn't have to be an emergency or it doesn't have to be transactional, right? And that also is another way to just destigmatize or change the culture around school-based health centers from being medical or being like you go there because you're sick, something's wrong with you, quote unquote, which is never the case, right? Or changing it from that to changing it to be like, yeah, another place you go. It's just the place you go because whatever, because it's the place to be. And I spoke a bit already about the unique position of school-based health centers in the community because you're on the front lines there. And so, yeah, those are a few, reflections, a few points, a few things to consider. And yeah, thank you, Pearl. And so kind. And yeah, if there's any other questions, I'll be looking out for them. And I want to pass it on to the doctors here so they can tell you the real deal brass tacks and how this works. Okay, on to the next one.
Jada, thank you so much. That was incredible. Thank you for being willing to be authentic and be vulnerable and share your personal experience with folks that that do the work, yeah, thank you. All right, so I'm going to talk to you all a little bit about kind of the relationship aspect of screening. Um, one of the questions that Jada had mentioned that came in earlier was about how to incorporate protective factors into ACE screening, and luckily we are going to talk about that too. So, how do we gather information when we're screening for ACEs in a trauma-informed way? So, I'm not talking about like handing the screen to someone. I'm talking about once you get the screen back, what do you do? What do you say? We've gathered this information over years of working mostly in primary care because we've had folks ask us those exact questions. What do I say? What do I do? These are really tough questions. And so one of the ways that we do that, of course, is we want to build a relationship. And hopefully you may already have a relationship with someone coming in. It also could be the first time, and that's okay too. One of the things to keep top of mind here is kind of the purpose for ACE screening. Um, it's actually not a screen for trauma, believe it or not. I know it seems like it is, but what we're screening for is risk of a toxic stress response. And toxic stress is a medical condition. It's the body's response to lasting and serious stress without enough buffering support from a caregiver. So when a kiddo does not get the help that they need, their body can't turn off that stress response normally, right? And so the lasting stress can harm a child's body and brain and can cause lifelong health problems. So that's why we're screening for ACEs. And one of the ways that we can do that is what I'm talking about right here with the slide in front of you. It's called triads. So this is a framework that can help you gather information about current concerns, medical social history, and about screening. And this isn't just for medical professionals. This is for everybody that is going to be talking to folks about the ACE screen. So triads stands for, as you can see here, trauma and resilience informed inquiry for adversity, distress, and strength. And this is an evidence-informed approach for screening, for provider response, for patient education about ACEs. And although we have done this in primary care, we are now applying it to school-based settings. And so we are so excited for all of you doing this work to help us learn about that, because it's a new area for ACEs Aware. And again, this is just one way to gather information that's going to inform kind of the clinical assessment. It's not something extra that you have to do. So the clinical assessment and info gathering is kind of the what, and this is an example of the how. And what's really nice is that you are all already doing this. Anyone who's talking with kids, or patients or anyone else about this, you're already having these conversations. And triads is just a way to help you kind of organize thoughts within a clinical encounter. It's a quick tool that can help you cover all the bases. It's about having a conversation, right? Folks are afraid to have these conversations, to ask difficult questions. And so again, this is just a framework for how to do that. It's a language, it's an approach to help develop those relationships that heal in the context of a clinical encounter. So I'm going to just talk really briefly about kind of where this came from. So, as Jada's talking about how important it is to, get real people's experience with this, right? Um, we we got a lot of community input for this, for triads, community wisdom. We had interviews with patients and other community members. We used evidence-based interventions for traumatized children and families, and influential trauma and resilience informed clinical change frameworks for both pediatric and adult. And Triads was created by a team led by, I mentioned her before, UCSF professor of psychiatry and behavioral sciences and director of the Child Trauma Research Program, Dr. Alicia Lieberman. We just want to give her credit here for her 25 years of research on children and families who are experiencing trauma, how to heal relationships in people, and bringing over this mental health framework into the world of primary care and now into school-based health. So the three elements of triads, as you can see on this awesome little picture here, are adversity, which is what happened to you, distress, which is how are you impacted, and strengths or protective factors, which is who helps you and what helps you. Next slide, please. Thank you. All right, so the elements of the approach, put it in a nice little table here. So we want to show you how triads aligns with the recommendations of ACEs Aware for gathering information. So a complete ACE screen involves three things. One, understanding a patient's exposure to adversity, the clinical manifestations of toxic stress, and the protective factors. So the first two help us determine the clinical risk for toxic stress, and all three help to guide effective responses and partnering with your students for a treatment plan. So in the left column, you can see those three categories: adversity, distress, and strength. And the middle column shows what types of info that ACEs Aware recommends gathering. And so for adversity, we're using the PEARLS, which is the pediatric version of the ACE screener, or the ACE screener itself if it's for adults. And so for distress, distress is basically the clinical manifestations, right? The current stressors and ACE-associated health conditions, which are those conditions that the research has shown a particular number of ACEs can make you more likely to have these particular conditions later in life. And then for strengths, we're looking for, we call it many things: resiliency, buffering factors, protective factors. And then in the final column, you can see the different areas of the clinical encounter, and then the triad's core strategies here. So for adversity, we're reviewing the screening, right? What are we doing? We're asking with empathic interest. Like we got to be interested in our folks, right? We're curious. We're asking them about their experiences of adversity and trauma using the PEARLS tool. And we can have this conversation. So you have the number of ACEs in front of you, and some people want to talk about what happened to them and some people don't, and that's okay. Showing your interest and your curiosity and the fact that you are a trusting person in their lives is really what's important. And the question that we're really asking with these screens is what happened to you? And of course, also in the present, what's happening now? And when we're addressing distress, this is, we're collecting the medical history, social history. If it's in a medical setting, maybe performing the physical exam. And so we're describing in a supportive, non-judgmental manner the possible links between the patient's adverse experiences and any presenting physical, emotional health conditions associated with ACEs. It could include behaviors and habits that may be harmful to a person's health, including the ACE-associated health conditions and then the current stressors. And it's really simple to to ask folks like how are you? Like what's going on with your health? How are you feeling? And how are you holding up? These are just very simple questions to get I mean, you're gathering the information, but you want to know. You want to know how your person is doing. And then, of course, this is the most important piece of all of this is identifying the strengths, right? We're evaluating protective factors here. We want to help the patient identify personal characteristics, relationships, community resources, anything that can provide support and buffering and enhance well-being. This is part of the social history that you're gathering. You're reviewing these resiliency and protective factors. And Rachel's going to talk a little bit more about our stress busters, which is one of the amazing ways we can do this with folks. And some of the questions for how do you get at protective factors, you can say who helps you, what helps you, what's helped in the past. And if you're working with parents and kiddos, I love to ask parents, what do you love about your kid? So there's so many different ways to get at protective factors. And one of the things I just want to remind everybody is that every single one of you that is working with these students or with patients or with clients or whatever the role may be, you are a protective factor for these folks that you're working with. So I think that's something that is really important to remember, that you yourself are one of those protective factors. Next slide, please. So when we were doing this work, when we first started out and even up through now, again, folks are asking us, okay, this is great, and thanks for giving us some examples, but we really want to know how you keep saying, we're going to ask these questions and like what do we say is what people were asking us. So we've gathered these over the years just to help folks with ideas. And there's no really right way to say this. There's lots of ways, and so much of it depends on you and your personality and your clinic and values and all sorts of different things. But these are just some ideas to build off of. And so when we're reviewing the screening, we want to provide a simple rationale for why we're doing this without judgment, right? There's no judgment here. Some of the things we've said is we're learning that difficult experiences that happen to children can affect their health later in life, just like positive experiences can. So we don't want to leave that out. Your answers can help us understand your health better, and we can make decisions together. And really, the biggest rationale is that ACEs are so common that we're starting to ask everybody about them because they do have such an effect on our health. And along that line, I just said it, we're normalizing adversity, right? They're really, really common. So we're screening everyone, or we're screening students, or whatever the population might be. We also want to give folks, make sure that they have their own power. We want to ask them, right? Would it be okay if I gave you these questions, if I asked you some questions about your childhood? And, you don't have to answer anything that makes you feel uncomfortable. I will say, however, that, again, having that rationale is so important, not just for you, but of course for the patient, because if it's just another screen that's in there and you don't really explain it and the student's like, why are you asking it? It's really important to explain why we're asking these questions and how it is tied to their health and well-being, and we want to help them. So having a good rationale is going to help folks be more willing to disclose and be more willing to answer the questions. So, and then we want to acknowledge with empathy, of course. Sometimes that's really all you actually need to do. Some folks think, oh, people are going to come in and they're going to need all this extra support and I don't know what to do. And we have found that you being there and just acknowledging what has happened to someone can be all they need. So, you know, just, and again, acknowledgement is hard because we want, especially for healthcare providers, you want to fix things, right? But we don't have to fix how people feel, right? We're acknowledging, wow, that sounds really difficult. Thank you for telling me that. Thank you for sharing that with me. And again, we can normalize. We're finding these things happen to a lot of people, and there's a connection between what happened to them and their health. Does that resonate with you? So you can ask folks if they have ideas about what happened to them and maybe some current health issues they may be going through. And when I'm talking about health issues, I'm also talking about mental health. They all go together. And some patients actually told us that this was the first time anybody had ever asked them questions like this, and it really helped to build that trust and promote healing. Okay, one more slide for me. Thank you, Jada. And so this is some examples of discussing medical and social history with triads. We want to ask about the distress, kind of the how is it affecting you, and the ACE-associated health conditions. We want to stay curious, like I said, and we're not judging folks here, right? How do you think that your past experiences might be affecting how you're doing, how you're feeling, and your overall health? And then again, we're asking about the strengths and resilience. What has helped you in the past? What helps you now? Who helps you? Any kind of questions where you can kind of get at that, those ideas of buffering and protective factors. And so again, these are just some examples of ways to talk with patients about adversity. We encourage you to find your own way that makes sense for your own practice, for your own personality. And really, to truly transform the quality of healthcare, the medical system and individual team members, we need to understand and respond to patients' adversity and distress while enlisting their strengths in creating and implementing whatever kind of treatment plan or follow-up that we're going to be doing. So it needs to be all three: the adversity, the distress, and the strength. And before I turn it back over to Jada, I want to leave you with a quote from Dr. Lieberman. She says, "You do not have to be a therapist to be therapeutic." And I just love that. And so I'm going to give it to Jada to see, Jada, if you have any, given that you have had your own experiences in school-based health, if any of this resonates, if basically I'm just going to give it back to you for any reflections that you have. Thank you.
Thank you so much, Dr. Bradley. That was absolutely wonderful. Yeah, that was great. And I really appreciate you emphasizing how much being of service to young people in the context of health centers, or maybe you're an educator or whatever, like being in that position and being in that role is in and of itself a protective factor, granted that you are interacting with them in a therapeutic way, like you said. I really love that you emphasized that because I was kicking myself that I forgot to mention that bit of like just having someone you can trust that you can go to who they call non-parent adults, like how helpful that is as a buffer between toxic stress. And I definitely know that to be the case for myself. And sometimes, it like culturally, I grew up in a what happens here stays here household, but that mentality I think begets or enables more like trauma because of secrecy. And I think a lot of trauma thrives in secrecy, and I've heard that come up in our councils as well. And so it is essential to be a safe non-parent adult in the lives of like the students that we're talking about. So I love that that's a big part. And I just really love the way that you broke it down in general and was specific about different ways you can show up. You don't have to be a superhuman in order to really support someone. Another last thing I wanted to mention is that when applying the triads framework and just in general in this conversation, that a lot of the students who are experiencing the highest ACEs that maybe need you the most might be those most likely to be truant. I also was truant in school. Though I was a very obedient student and I cared a lot to learn, I was just too stressed out to go to school. And so it wasn't that I was bad. And so if we can also figure out a way to destigmatize truancy, like it's not, it doesn't mean you're a bad child. I think that there can be a lot of punishing kind of things around that. It doesn't mean you're a bad student. It just means that, yeah, you're probably dealing with a lot of things. But if you are applying some of the frameworks or tools that are offered in this webinar, maybe you also might consider setting sort of goals or thinking about it as a collaborative long-term project. So throughout the year, maybe there's certain goals or metrics or just even small steps that you have their buy-in for, so that even if they don't have the capacity to go to class and they'd rather skip class, they do have the buy-in to go work on that goal for their health, whether it be nurturing their relationship with their friends or starting to develop an exercise routine or applying other stress busters in their life. That way they have something that they're working towards that's purely about them and their wellness. And maybe that can help retain some of the students who might be more likely to skip school. Okay, that's all for me. Thank you so much. I'm going to pass it on to Dr. Gilgoff, I believe.
These are tough acts to follow, so just really excited about this collaboration, partnership, and all that we're talking about. And to answer some of the questions in the chat too as we're going, really great questions. So, I think we're all here today because we all know that stress and trauma can have a profound impact on a child's health, development, and ability to learn. And where do ACEs fit in that spectrum of stress and trauma? So just to level set, the Adverse Childhood Experiences study was between Center for Disease Control and Kaiser in the late 1990s. And they were able to study over 17,000 adults who reflected on their childhood. And they, in particular, studied 10 categories of adversity around physical abuse, emotional abuse, sexual abuse, and neglect, as well as household challenges. So living with a caregiver who had experienced mental illness, was misusing substances, has been incarcerated, intimate partner violence, and divorce. So those were the sort of 10 original adverse childhood experiences. And there's so much literature and research to show that there are a lot of other stressors that can increase our risk for toxic stress, that can actually go into our body and change our physiology, change our neurology, our endocrine, immune, metabolic, genetic regulatory functioning. And so that's what we're sort of talking about today. So really great questions because yes, things like racism, discrimination, poverty, chronic illness, and life-threatening disease, parent death, separation, these are all things that happen to us in our environment that come into our lower brain, right through our cranial nerves, that actually are then changing the way our neurons are talking to each other, the proteins that are released. So it's actually changing our biology. And that's what we're really trying to get to today with this talk with ACE screening, such that ACE screening is really just a way to start these conversations. And so, all the ways that Jada and Chris have talked about, this is really about those conversations and how do we support ourselves as we're doing this work, because really it's all of you, our school and childcare personnel, who are often the front lines of defense for young people who are struggling. And that's a really big, heavy weight for all of you to carry. And so first and foremost, just a really big thank you. And I want to reach out and give you guys a big hug because you guys are there and doing this work. And so a really big thank you. If you look at the next slide, these are some of the things that you are dealing with, right? You're seeing how trauma leads to lack of school engagement, absenteeism, little things that feel little, like just not completing the homework, all the way to really these learning and behavior issues. The studies show that children with 4 or more ACEs are 32 times more likely to have a learning or behavior issue, right? We're seeing children even as young as preschool getting kicked out of preschool with these issues. And then we're seeing kids getting more and more diagnosed with ADHD and more kids getting put on medications at younger and younger ages. And again, you guys are the front lines. And so thank you. And what can we do together to support youth, but to support each other as a network of care in this work? Because it's going to take all of us, that village, to support youth and ourselves and each other. And so if you go to the next slide, that's what, we're talking about today. What I'm going to drill down on is what can we do about it? How can we support each other and our youth? And for me, what's been really helpful is using stress biology as a framework. And so that's the way I'm going to present it, so you can see different ways of coming at this same question. And what do I mean by that? So if you go to my next slide, what I mean by stress biology is it helps me think about, so there's this external environment, the stressors, that we can help students with what's going on in their life, in the school, maybe outside of that, what's in our control and what might we be able to do to lower those stressor burdens, and really recognizing that experiences change our biology. So what can we do for that internal stress response, those internal biological processes? And so I'm going to talk through this, right? Because that internal stress response is, first, what can we do in the moment? Something big's happened, my stress response is going off. What can I do in the moment? And then what are those long-term healing strategies to actually rewire the brain for improved health and wellness and success? And so that's what I'm going to dive into a little bit more. So if we go to the next slide, I am going to talk quick because we have so much good content, but I also just really want to get to questions. So if I talk too fast, please know you can always reach out to me, email me. I'm always happy to talk, meet, one-on-one, all that stuff is great. So I apologize, but I'm going to talk really fast. So when we're thinking about stressors, again, that's thinking, if there's a youth or a colleague, right, that has too many stressors, too big of a stressor burden, how do we partner with them, empower them, help connect them to resources to lessen that load, to really think about the environment and how can we be a supportive environment for that person? Thinking about safety, first and foremost, are there resources? Are they currently safe? We can think about social drivers of health. Do we need to support housing, or food insecurity? How can we listen and partner connect with people for what they need in this moment? We can help anticipate what are the stressors in that environment. And, on a very concrete level for, a child who maybe loud noise is a stressor because of what's happened to them in that past. How do we identify quiet spaces, sound canceling headphones, all these really great concrete techniques that you guys are already doing? How do we work towards prevention? There's a lot of really great child abuse and neglect prevention programs in schools that I'm totally happy to talk about. There's tools. We're not alone, right? So there's this whole broad network of care. acesaware.org/manage stress. We have a ton of resources on there. So we'll show you at the very end how to connect with that. But know that there's, the resources we're talking about today exist on a website. There's Find Help, there's Local 211, and each other, right? And so I'm super excited about the chat. Like, reach out because we really want this to be a way to build our networks of care together as well. If you go to the next slide, I hope, there's a way in which trauma-informed care principles, we talk about this a lot. So really quickly, establishing physical and emotional safety, building trust, recognizing the signs of trauma, promoting student-centered and evidence-based care when possible, really thinking about that collaborative approach across students, administrators, staff, healthcare system, right? Really building that network, and then always providing care that's sensitive to students and staff's racial, ethnic, cultural background, and gender identity. And then when you really just kind of boil a lot of that down on the next slide, there's a lot of this, that trauma-informed care has gone from that sort of what's wrong with you approach to what happened to you. Let's really, we want to know, tell us what's going on for you right now. and layering in and lifting up the importance of that strengths-based protective factors approach, honoring post-traumatic growth, inherited wisdom. And that's really that, what's right with you? Let's go. Like, wow, you showed up today. Thank you so much. That's amazing. Let's build on that. And what we're going to talk about more today, what's that healing-centered healing approach? What's healing for you, your friends, your family, our society, our systems, and doing that all together. So if we go to the next slide, this is now transitioning into, okay, something just happened and I'm really stressed out. And the window of tolerance is a really beautiful way to describe this to kids and adults for around what's happening to us in our body. And so I use this a lot with my patients. That light blue area, that's that zone of regulation, window of tolerance. That's where we'd like to be, where we hit bumps in the road, something gets us upset, stressed out, angry, sad. Our stress hormones might go off balance, but we have coping strategies and we have a support system and we feel safe so we can stay grounded, flexible, self-regulate, maybe co-regulate, bring people in, and we can get through it. All of us, sometimes something's going to happen. It's going to kick us into that red hyper aroused state, right? We're in that angry, hyper vigilant, yelling, kicking, screaming, or we might get kicked into that dark blue, hypo aroused. We're shut down, we're withdrawn, depressed, sad. We might even faint. One way to think about adverse childhood experiences and other stressors, what's happening for us, if we've experienced a lot of childhood adversity, we can get primed. We can adapt to that harsh and dangerous world such that it's protective to have a narrow window of tolerance, right? If I need to be able to jump into hyperarousal or hypoarousal quickly, it's really protective to have a thin, narrow window of tolerance for me and my environment. And that is hard, though, when you then are supposed to sit still at school, if your body is constantly ready to go in hyper or hypoarousal. So how can we do two things? One, help kids when they're in that hyperaroused or hypoaroused. What can we do to bring them back into that window of tolerance? And that's those techniques on the right that we're going to talk about. And just know that neuroplasticity means every time we practice these tools, we're actually changing our neural pathways such that we're widening the window of tolerance. So it's this beautiful both and of what we can do in the moment, and practicing that builds this longer term health and wellness. And so really just to think about grounding techniques. So these are the things that you can do today when you're working with kids. If you see somebody who, again, is in hyperaroused or hypoaroused and you need to bring them back into this moment, we can think about grounding techniques, right? And we can even do it a little bit right now. Just feel our feet on the floor. Feel our back against the chair if we're sitting. Really feel the sensation of gravity supporting us and holding us. If we want to bring people back into the room with their senses, we can use the 5, 4, 3, 2, 1 technique, right? What are 5 things that you see? What are 4 things you hear? What are 3 things you can feel? Let the kids kind of explore with their hands. Maybe feel again their back on the chair. What's 2 things you can smell? What's 1 thing you can taste, right? And it just brings us back to the present moment, to a calm, hopefully regulated state. We can pick our favorite breathing technique. A couple things to think about with breathing techniques. One, ideally breathing in through your nose, because our nose has a beautiful protective filtration system. We can think about breathing all the way into our belly. We forget that we have this beautiful diaphragm that can help us expand and take in even more air. So really feeling your chest and your belly rise. And thinking about a long exhalation breath, because there's this hack, which is really cool, where every time I breathe out, my heart rate slows. So it's a way to actually control my heart rate, to actually control my sympathetic nervous system. But pick your favorite breathing technique and you can teach it. Sensory support, maybe they need to grab a glass of water, maybe they need to move their body, maybe they need to listen to music, maybe they need a hug, or maybe that's more stressful, so maybe they need a little space. But really working with the student to see which of these is what's going to support and nourish them. Progressive muscle relaxation, tensing and releasing. Thinking about parallel activities, because eye contact can be really stressful. So can you do things side by side? That's where things like coloring for younger kids, doing Legos, taking a walk can be really soothing and can help kids open up and talk a little bit more. If we go to the next slide, excuse me, one of my favorite tools, and pretty much anything Dr. Bruce Perry does is some of my favorite, regulate, relate, reason. It's a tool for me to remember what to do when again, a kiddo is knocked out of their window of tolerance. And it's got a neurobiology approach to it, which my nerdy parts love. And so it's this idea that any communication, so me talking to you guys right now, you're hearing my tone of voice, you're seeing my facial expressions, you might be seeing some of my hand movements on the screen. And all of that, again, is going in through your senses, your eyes, your ears, into your lower brain. And that lower brain is really focused on regulation and safety. It's all those automatic functions, and it's, do I feel safe? And if I don't, I'm going to kick you into adrenaline and I'm going to increase heart rate, right? So it's really about safety. And if we know that, then we can start with that lower brain and that regulation and that safety. And that means really thinking about our tone of voice, getting on their level, maybe thinking of a safe space for them to be in. Then once they feel safe, then it goes up to that limbic emotional centers. And that's really about relationships and relate. And do I feel seen? Do I feel heard? Do you really care what I have to say? And so that's where we can really think about active listening. This is what I heard. This is what I saw. Did I get it right? I really want to know. And then really trying to be quiet, right, for a little while and really listen, which is so hard to do sometimes. And knowing that if once you feel safe and once you feel connected, that's the only time that it even gets to the thinking brain. So we can't jump to reason because that reasoning part of our brain might not even be online if we haven't gotten past the other two and if they're flipped their lid and in stress out mode. So regulate, relate, reason is really, and I use it, and I think I use it with my kids too, my own kids and my husband. It works in all cases. So it's been a really helpful tool for me. If you go to the next slide, I'm going to go a little quickly over this one. It's really just reminding us that behavior is communication. Kids want to do well. We all want to do well. So if we're not doing well, there's a good chance we neurobiologically can't do what we're being expected of us. And so really thinking about getting underneath, collaboratively problem solving, recognizing that the kicking, screaming, ignoring, zoning out, it's a frustration, stress response. They're trying to communicate, I can't do it. I want that reward. I want the sticker. I'm afraid of the punishment, but these behavioral approaches might actually backfire because I want to do it, but I'm neurobiologically, I can't do it. And so now I'm even more stressed out and more frustrated. So a plug for Lives in the Balance, Dr. Ross Green's collaborative problem solving approach, because they actually have tested it in schools as well as juvenile justice. And it does decrease suspensions, it decreases behavior outbursts. But the core concept of it is that we are collaboratively problem solving with the youth. And that goes to a lot of what Jada was talking about, bringing in the youth into our problem solving on an individual level and on an organizational level. And so the next slide is really just recognizing that this isn't about being perfect. They've done studies and we're really only attuned with kids as adults about 30% of the time. And there is beauty in that mismatch because that 70% of time is where resilience is built, right? You need a challenge to overcome it to build your resilience muscles. And it's also where connection is built. Because I mean, if we think about it, when have we had those really close connected relationships? It's in those messy times. It's not during the rainbows and roses times. So it's beautiful time. Even that 70% of mismatch is this opportunity for connection and resilience and doing the repair and doing that connective work. So now I'm going to transition to stress busters, near and dear to my heart. And this is really a framework for thinking about long-term healing. And so if you go to the next slide, just to know, again, with this frame of toxic stress is preventable, it's treatable, healing is possible at any age. And these 7 stress busters, supportive relationships, nutrition, physical activity, mindfulness, nature, sleep, mental health, all of them have been shown to improve neurologic, endocrine, immune, metabolic, and genetic regulatory function, essentially countering that toxic stress response. And so I hope that you're getting from all of our talk that this is possible collectively, multidisciplinary strategies. We can do this, and we have the tools to help our youth as well as ourselves heal and cope with current and ongoing stressors. And so the next few slides, I'm going to go pretty fast because we're really getting close to out of time, but I might just highlight a few stress busters, and then I can always, again, reach out and talk about more. To pause for 1 second and just say a really big thank you to our community councils, giving all of you guys a really big hug. The tools and resources that are in this talk, that are in hopefully a CBO toolkit that's coming out in March, come from this combination of lived experience from community partners, clinical expertise from our healthcare partners, and literature, the research. So a big hug to all our community partners and our network of care. So the next few slides, we break down every single stress buster, and we did sort of a tiered approach. So green is universal, which you could do for everybody. Yellow is for a little bit more support, and red would be, ooh, we need to engage, a broader network, maybe more referrals and partnering with, specialists. So that's how it's broken down. And so if we think about supportive relationships, this is what we all know, how important relationships are. I don't know how much everybody knows it, because we actually live healthier and longer with both safe, stable, nurturing relationships, that close relationship, as well as a wide variety of social supports and activities. And in fact, there was a meta-analysis, a big study that showed that supportive relationships were more important to our health, more important than how much physical activity we get, what our weight is, and how much alcohol we drink. And just as important as how much we smoke. And we know how important those are to our life and longevity. We don't really think about it on a regular basis of how important our relationships are, that they could actually help us live 10 years longer. So what do? Really educating people, taking time to encourage that time in simple things like just taking 15 minutes to put down our phones, close our computer, to focus on another person, really actively be present in the moment with a relative, a friend, a colleague, that youth, and thinking about how that's boosting not just the relationship, but our health. It's actually changing, again, our inner physiology when we do that. And encouraging that wide variety of supports in the community. So sports teams, dance groups, volunteering. For those who might need, support connecting, or might actually needs to build skills. Maybe I don't know how to be a good friend. Maybe I haven't had those role models in my life. We can really connect them with community programs, support groups, mentorship programs. For parents who need extra support, there's parenting programs. And then also recognizing in this red zone, if we've experienced a lot of adverse childhood experiences, there's a good chance that there's some relational trauma there, right? So if we've had a lot of negative experiences with relationships, we're gonna have trust issues and attachment issues, and we really need more support in the form of mental health therapy, like individual counseling, maybe family therapy, maybe couples counseling for parents, or dyadic child-parent therapy for the kids and the caregivers. And that's where, again, this broader network of getting kids connected to the support that they need to really build their skills and their support network. And again, all these resources are on the acesaware.org Manage Stress website. We can share them. You can email or email or get to the website, and we'll share all that. The next one is nutrition. And I think it's super fascinating that stress can increase or decrease our appetite. How could one thing do two different, totally opposite things? And it's because we actually have phases to our stress response. So immediately it's activating our adrenaline sympathetic nervous system response. And that is shifting energy to my muscles to be able to get ready to fight or flee if I need to. And so it's deliberately shunting energy away from digestion and telling me not to be hungry. We've probably all been in that space where we're so stressed out we're not hungry. That's the adrenaline phase. minutes to hours to days later, we're in the cortisol phase, and cortisol is essentially saying, okay, the threat should be over, so stock up and get ready for the next threat. So it's telling you to actually crave high fat, high sugar, high energy foods. It's actually telling us to crave ice cream and potato chips, right? And then we eat the ice cream and potato chips. It actually does lower our cortisol, and we get a dopamine hit. It says, good job, you did it. And so then now it's in our brain that eating potato chips and ice cream is a healthy, well, it's a coping strategy that seems to work. So our body is primed to keep doing it. So first and foremost, taking away blame and shame for ourselves, for others. And if we know that biology, if we can, then we really are trauma informed. So we can think about mindful moments. Okay, I know that my stress response is activated and it's telling me to crave these things. Do I really want that? Oh, I can take that mindful moment and pause. And then having easy access to healthy, high fat, high sugar foods like bananas and grapes and nuts, if kids can do that, right? How can we have some healthy, easy access substitutes? If we know that trauma increases inflammation, how can we think about anti-inflammatory diets, right? How can we think about decreasing processed foods? How can we think about this on a systems level, right? What does that mean for our school? The kinds of, you guys are doing some beautiful work around giving kids breakfast and lunch and dinner, because that is really such a support for them. And then really thinking about what those healthy meals and snacks look like, what's in our vending machines. There's a lot of resources too for recognizing that it's hard to afford healthy food. There's busy schedules and devious marketing campaigns, so it's even hard to know what is healthy sometimes anymore. So again, there's tools on acesaware.org. You can go to, there's actually farmers markets that take food stamps and double the value of food stamps. There's free meal planners, there's support groups, there's food banks. And then for some people, they are going to maybe struggle in a way that they need additional support, like they are having an eating disorder and need additional support, or they need to see a GI specialist because they're now having, GI upset, or a mental health specialist. So lots of ways to support across our networks. I think, okay, let's see. Physical activity. I'm going to just say some highlights of the next ones because I really do want to try and end in about 2 minutes so that we have time for questions. Physical activity, just think about that when we are super stressed out, we have all this energy, but then we have to sit still in class. So how can we think about brief physical activity breaks to release that energy, to release that stress energy, and thinking about how we could incorporate that into daily routines, or if we see a kid struggling and they're getting all fidgety, allowing, creating space to allow them to release that stress energy through activity. If we go to the next one, mindfulness, I just want to point out that when we've experienced a lot of adversity, mindfulness can be extra challenging. And so to have that in mind, that it can be really hard to close our eyes, it can be really hard to sit still, it can be really hard to focus on breath or sensations that might not be comfortable for us, to trust the people around us. And so really incorporating a trauma-informed approach to inviting people and giving them choices. Close your eyes or look at the floor. Thinking about building safety over time. Thinking about that there's different ways to practice mindfulness. So we think about meditation and having to sit still and focus on our breathing, but you can say, no, we want you to be mindful about what your body needs and attend to what your body needs. So if you need to move, that's fine. Or if you need a more active mindfulness kind of approach, maybe it's a walking mindful meditation, right? As opposed to a sitting still one. So lots of ways to be trauma informed in how we provide mindfulness interventions. Nature, lots of great ways. In schools, I think you guys are ahead of the game on this one in terms of creating more green spaces. And it can be, a park, a garden. It can even just be indoor plants, or even honestly, pictures of plants have been shown to be really soothing. So lots of ways to incorporate nature into our programming. Sleep. Sleep is the next one, and it is one of the most common consequences. Sleep disturbances are one of the most common consequences of adversity and stress. So a lot of kids could be coming to school tired. So one, just again, decreasing blame and shame and supporting them when they're tired. I don't know if this opens a can of worms, but really thinking about their circadian rhythm and later start times. But that's a larger discussion and happy to talk about it. But really just decreasing blame and shame, thinking about how to help them feel safe before they go to bed, lower those stress hormones. I have lots of tips and techniques for that, and we could talk about it. And then mental health, just to say really quickly, one plug is that not all mental health providers are specialists in trauma. So just thinking that through, like if you're going to refer to another specialist, are there ways to identify therapists that are specialists in trauma if that's what we're trying to support that youth with? So many things I could say. Next slide, I will skip. That's more just about future research. But I really want to leave time for talking with all of you guys, letting Jada have some time for some reflections.
Thank you, Dr. Gilgoff. I don't know about y'all, but it's like there's so much, like I learned so much every time I hear you speak, so thank you. Yeah, I also want to leave time for questions. I haven't seen the question box yet. Oh, there it goes. Q&A. So I don't know if how many there are, but yeah, I really appreciate the creative ways that Dr. Gilgoff mentioned of incorporating the stress busters into school-based health and just school settings in general. A couple ideas that also came to mind while hearing Dr. Gilgoff speak was um, incorporating maybe monthly events dedicated to different stress busters. So maybe there's a monthly mindfulness event and then the monthly movement event. Also collaborating with food banks and starting to integrate as much as possible. Not reinventing the wheel, but joining forces with other groups that already offer, those types of supports. And one last thing that comes up a lot, especially when I talk to young women or women of all ages, is that they wished they received more education about how their body works. I feel like just this presentation right now that Dr. Gilgoff just gave really helped illustrate what can happen to your hunger, appetite, sleep schedules, like sleep cycles, all these different things, like understanding your body. And then also for women and young women in particular too, what is their cycles? What is perimenopause? What is menopause? Like trying to get an understanding of the body that they live in and the lifelong like health trajectory that they're experiencing. And that's just come up a lot. And I don't know how much it exactly relates, but at the very least, having some chances, again, going back to the importance of the education piece, to understand why do I feel so tired in the morning? Um, Also understanding that taking the blame off of maybe it's not them and their fault that they're feeling tired, but also school should start later. Like there's systemic parts of it and everything. And the more that they know, the better. There's so many, of course, different ways to deliver that information, but overall, this was so much, just a really packed webinar, and I'm excited to hopefully see folks' questions. Thank you all so much again for the opportunity to speak and to listen and just be here with you all. I guess while we're here, okay, wait, yeah, here. Okay, let's start with this question. Um, I'm a caregiver who works in a school district. I have a question that's been on my mind for a while. I don't know where to go and who to ask, but my question is, when a child, high school age child, who has a history of ACEs, has an anxiety disorder, is receiving therapy, and has repeatedly triggered by an event at school, and as a result reaches that hyperarousal level, not hurting anyone, just extremely emotional, angry, overwhelmed, is the only solution suspension, asking for a friend? Does anybody feel compelled to start with this one?
I definitely want to. So Chris is our mental health specialist on the call. I would definitely hope that the only solution is not suspensions. I mean, I think that is kind of the goal of all of our works, to really support that youth, and really collaboratively problem solving with that youth to see what are the triggers and how might we really think about both the environment to decrease that, can we decrease the triggers, and how can we work with them in their internal stress biology, and thinking about a lot of the tools that we talked about today. Again, happy to take any of these, more specific questions offline if you guys want to email us. Chris, I would love your thoughts. I saw you come off onto camera too.
Yeah, I mean that's quite a question. We did say ask anything, right? Um, yeah, I mean suspension is like the last place we want to go, right? And what I think about is resources here. I think about resources and I think about relationships. And it's interesting. My sister teaches second grade, and she every day comes home and has these same, what do we do? And so much of it has to do with resources. Is there someone first of all, I mean, I'm thank you for not giving details about this. I appreciate that. But when we say reaches that hyperarousal level, like that could mean a whole lot of different things. And so, you know, like Rachel was saying, is there someone there that the student trusts? Is there someone that the student has a relationship with? And again, even if there is that person available? And I'm thinking about resources and time and having the extra support in the classroom, like paraprofessionals, like make the world go round, in so many cases. And sometimes they're not available. So, you know, it's an incredibly difficult question, and I feel like since the pandemic, things have gotten so much harder for kids in school and the whole development issue. Like that, we could talk about this for weeks, right? Um, but I would just go with what Rachel said, which is like, are there any other options besides suspension? Jada, you were talking about, truancy, and like we're trying to keep kids in school, not kick them out, right? And like Rachel, you were talking about kids getting kicked out of preschool. It's just it's horrible. It's sad. And so it to me it comes back to this issue of who can kids trust in school and who can they go to? And for educators, like identifying, are there friends? Are there, peers? Just yeah. And of course there's so many things about talking to parents and all of that. But yeah, my answer is that there's not an easy answer. And the more that we can encourage these building these healing, trusting relationships, whether it's between, educators and kids or peers or counselors or again, resources. In a lot of schools, there aren't counselors. So I'm just so happy that this group, there are people, right? School-based health centers, right? Like there's wellness centers, there's resources for kids, and that gives me hope that we're not going to see as many of these just awful situations where is suspension the only, is that the only way to go?
Exactly. And so much comes up for me here. Like even thinking about suspensions of preschool, the majority of those suspensions are happening to young black boys, little boys, right? Or yeah, it's just like another way of systemic racism also in like the school to prison pipeline to do its thing. Of course, we don't know the specifics of this scenario, but it sounds like what is happening is this person was hurt, or the student, right, was hurt or traumatized and is experiencing a response, and that the attention is going to the response, but maybe not so much of the cause. Like if it was done by someone else, if anyone's going to get suspended, which I don't think anyone should be because it's not really going to solve the problem, maybe consider the person who caused the harm, right? Again, suspension is almost like a timeout and then they come back and then it starts over again. And so thinking about interventions, like every time there is I think it sounds like there needs to be a plan that's set in advance to know, to anticipate the need should the trigger come up again, which it likely seems like it will if it's happening routinely. And when they are not in a space of hyperarousal, making a plan with them. Okay, so what's going to be our backup plan if you get triggered? And then maybe a few different plans. Plan A, plan B, plan A, go to the school-based health center immediately, right, to decompress. Plan B, take a walk with such and such around the block, right? Plan C, whatever. Maybe you have more of a restorative justice circle. It depends on how much you want to engage in it, but getting to the root cause and also, again, not focusing so much on the response, but focusing on the harm and getting to the root cause of it and addressing that to the point where they can receive closure, I feel like would also be good instead of suspension. Suspension, like, I just really can't imagine any positive result of that, which I think all y'all know.
Thank you, Jada. That was amazing. And thanks for hitting the nail on the head with the systemic racism. We know that in schools, I've seen it working in school-based health centers, you get sent a kid with a certain skin tone for something that was done by another kid with another's. I mean, black and brown kids get sent to, the principal or for the same things that white kids are doing, but it's the perception of the educator or the staff or whoever. So for all of us to take a look at our own racism, it's huge. And this is a big thing to end on, of course. I'm just noticing the time. We've got 3 minutes left, and we promised we would give it back to our School-Based Health Association team. And Amy, maybe you want to take the huge question that was also put in the questions about federal money.
I do want to we have just a few slides that I think could be a little helpful too, because just to know that there are other resources. So for example, if your school doesn't have a wellness center, if your school doesn't feel like it has a person who knows about trauma-informed care, there is a 2-hour online free educational thing. So you could ask, the schools to do it. We have a lot of resources and training, and you can get a copy of this PowerPoint, so then you'll have links to all these resources. And I think this is where the conversation, I'm so excited to continue it with you, because it really is this partnership of training school professionals to be trauma informed so that they can do all these steps for these kids who need this support, and recognizing that those youth might also need to be referred to a trauma specialist, a mental health specialist, and you could always partner with their medical provider too, who can write letters and help support IEPs and help support what are those concrete supports that the kiddo needs, and helping with that collaborative problem solving. So a way in which we're all helping each other and the youth. So thank you. So yeah, it's Amy, sorry. I thought this might happen. We would go right up to the time. We turn it over to you.
No worries at all. I'm glad that there was questions and there was answers, and I'm so thankful for all of you staying with us for the past hour and a half to really take advantage of this moment to have expertise in the room around ACEs and response. I can't really respond to that question that's in the chat about the change to federal dollars and policies, because I'm not the right person to answer that, but of course, we're all very anxious about potential changes to federal funding, and there are folks in our policy groups that are really focusing on what our response is going to be. So thanks for that question, and I wish I could answer it better. But I just wanted to end us by letting you know about upcoming webinars through CSHA. I mentioned that this is the second in our ACEs Aware series. There was one in October, and we can share out those slides and recording, and we will have another one in the spring, so look out for that. We also have a webinar next week that we'd love for you to participate in, supporting LGBTQ students through increased hate. The registration link is there, and Allie, if you could put that in the chat for us. Keep an eye on our website. You can sign up to receive all of our announcements about trainings and webinars and conferences, etc. We also have resources around growing school-based health and uplifting school-based health centers and wellness centers. This QR code gets you to some of those resources, some of our main ones, and just to say thank you. Thank you to our wonderful presenters from UCAN, and thank you to all of you for spending the time with us. And we wish you a great rest of your day.